Good afternoon, everyone. Thank you for joining. This webinar is going to get started in about 90 seconds. We are just waiting for people to continue trickling in through the registration process. Thank you. All right, good afternoon, everyone. Welcome to today's webinar hosted by Astendio. My name is Ian Walsh, and I'm going to be your host today. This is going to be an awesome presentation. We've got an expert panel today. The subject is how to implement enhanced direct enrollment for success, and this is the CMS enhanced direct enrollment process. It's a very interesting and very challenging topic that for people who are attempting to go through this are realizing just how big and broad and complex it is. But we're really excited to have some people who are experts in this area. So today we'll be joined by Pete Nakahata. He's the principal and founder at PTN Consulting. Jermaine Jones, who's the co-founder and COO here at Astendio, and Stephen King, who's the strategic account executive at A-Line. And collectively, we're going to get from these three individuals three different perspectives from an outside expert's perspective, from a technology perspective, and from an audit perspective as to what good looks like, what it takes to be successful on going through this process, and what you need to know if you're thinking about going through this process. What are the pitfalls? What does the scope look like? How do you need to be approaching for this and planning for this? And what do you need to make sure you do in order to maximize your chances for success? So before we begin, just a couple of housekeeping notes. We are recording this webinar, so we'll make it available to you afterwards, and we will share a link out to that. Everyone's going to be in listen-only mode. There is a questions panel in the chat, so you can put your questions in there, and we are going to take questions at the end and answer as many as we have time for there. So without further ado, I'm going to hand it over to Pete, and Pete is going to get us started talking about the enhanced direct enrollment process generally and what he's seen for people who have gone through the prep for that. Pete, over to you.
Thanks, Ian. Good afternoon, everyone. My name is Pete Nakahata, and I'm principal and founder of PTN Consulting, LLC, and we're a consulting firm focused on health policy and technology. I'm a member of CMS's Industry Advisory Group on direct enrollment, and I'm a former CMS technical advisor that helped build the exchange marketplaces and worked on the initial development of direct enrollment. So I'm going to provide a brief overview of enhanced direct enrollment. And so first, let's get into this. What is enhanced direct enrollment, or EDE? Simply stated, EDE is a program that allows for private sector partners of CMS, whether that's web brokers, carriers, or technology vendors, to host an application for exchange coverage on their own websites. This means that consumers and agents and brokers can complete an exchange eligibility application and enroll in exchange coverage without ever having to visit healthcare.gov. Partners can use their website to collect application information, then using APIs, exchange information with the federal government, which renders an eligibility determination. Then the partner conveys that eligibility determination back to the consumer. The federal government still makes the eligibility determination for exchange coverage, for tax credits, or potentially for Medicaid and CHIP eligibility. But the important thing here is that the consumer gets the same eligibility determination as if they had applied on healthcare.gov. But it's not just about eligibility and application and enrollment. It also facilitates post-enrollment customer service and policy management. It enables private sector partners to assume a greater role in communicating with consumers about exchange actions related to their insurance policies. And one final thing to note here is EDE is only available in federal exchange and state exchanges on the federal platform, which is about 37 states. So what that means is that that doesn't include the 13 states that operate their own state-based exchanges, like California, Washington State, or Minnesota. So why EDE? So some context here. Several reasons that the federal government is making EDE available. One is that the consumer experience for the original direct enrollment, or classic DE as CMS likes to call it, is pretty awful. Classic direct enrollment users face multiple redirects between the DE partner's website and healthcare.gov, and few users actually complete this process. So CMS has long wanted for consumers using private sector websites to access exchange coverage. CMS also wanted private sector partners to be able to innovate and find ways to improve their enrollment experience. And CMS finally also wanted private partners, especially carriers, to be able to take on a greater role in managing consumers' policies. So let's talk a little bit about what's involved in setting up an EDE solution. First, it requires potential EDE partners to develop an EDE user interface, which includes development of an exchange eligibility application, which is a dynamic application that changes really sort of based upon the answers provided by the consumer. And it requires partners to follow rigorous guidelines for developing the eligibility application, so it yields the proper eligibility determination results. Also, as part of the user interface, partners need to be able to electronically submit enrollment information to the exchange. And it also involves development of certain consumer service functionality, including checking for data matching issues or special enrollment period verification issues associated with a submitted application, uploading documentation to address data matching or SEP verification issues, and retrieving exchange notices. Potential partners also must demonstrate that they have a robust privacy and security posture. Steve and Jermaine will talk a little bit more about this, but basically it means demonstrating compliance with NIST 853 standards and that the partner really has a functioning security and privacy hygiene to ward off any external threats. CMS views EDE as extending its security perimeter to include any approved private sector partners. So they're going to expect partners to fiercely defend CMS's expanded security border. Potential partners also have to complete an operational readiness review conducted by an independent auditor, and Steve will talk more about this in detail. But it basically means completing a business audit, a privacy and security audit, and then having CMS conduct its own review and mini audit. And finally, once approved, partners need to demonstrate ongoing compliance. On the security side, that means complying with CMS's Information Security Continuous Monitoring Program. Okay, so let's talk a little bit about planning considerations. One of the first sets of questions that any partner contemplating EDE should ask themselves is whether it's worth it to build your own platform or to leverage the platform of another approved partner. And this is basically your basic build or buy decision, and answers will vary based upon business needs and operating context. If you decide to leverage an approved an entity's platform, then your next decision will be whether to adopt a white label solution. In other words, use the primary partner's platform sort of as is, only with minor cosmetic changes, or retain some of the EDE functionality on your own, such as your own planned shopping experience. The downside of that approach, though, is that CMS may require a supplemental audit of you. If you decide to be a primary partner and build your own platform, then you're going to need to decide which EDE phase to support. And really there's three phases here. Phase one is the most simplified version of the application, which supports about 60 to 70% of the eligibility cases. Phase two, which is an expanded version of the application, which supports all phase one cases plus some additional eligibility scenarios. And then phase three, which is the kitchen sink, which is the full application and supports all application scenarios, but it's also the most complicated build. And if you're a primary partner, here's some of the resources that you're going to need. You're going to need a dedicated UI development team and supporting technical team. You'll need contributions from product, engineering, and QA resources. You'll need a dedicated internal and possibly external team to work on security and privacy preparations. You'll need an independent auditor. And then some sort of compliance platform, workflow, or system, some way of keeping track of all the compliance requirements, processes, and deadlines, and particularly those that are related to security, because there are many. Okay, so the next couple of slides contain a fictitious sample case study of what an EDE implementation might look like for this coming year. And in this case, the primary partner that I'm using as an example is either a web broker or a technology company vendor with some experience in participating in classic direct enrollment. In other words, they have some experience in exchanging enrollment information electronically with CMS. And they're going to need to develop an EDE application, leverage and integrate their current enrollment submission capabilities, and develop post-enrollment UI and functionality. And finally, they've got some existing security practices in place, but need to develop some processes that are required by CMS's control that they don't already have. And they don't have much documentation in place around security, which is pretty common. So this slide shows what an EDE implementation might look like if the partner got started at the beginning of October. And the actual timeframes are really going to vary based upon how the partner resources the project and whether it has experience working with CMS on electronic transactions. CMS has a single audit submission window every year, and so prospective partners need to develop their implementation strategy and timelines around that window. In 2020, the audit submission window is going to open on March 1st and will run through June 30th. So prospective EDE partners have to submit an audit package that CMS deems to be complete by June 30th. So for purposes of this sample plan, I've targeted an audit submission date of April 1st, which is early enough in the audit window that CMS reviewers will have enough time and resources available so that the partner will be able to have their best chance of a more rapid review. I won't go through this slide in detail, but you can look at it at your leisure, but it contains some of the key components that are required to get through the audit, to prepare for an audit. This next slide shows what happens once the audit package has been submitted to CMS. CMS review process takes several months to complete, and that's really sort of the bottom line here, is that you need to allow for several months for CMS to go through each of its review steps: completeness review, a subject matter expert review, and a CMS mini audit, which takes all combined to take at least 4 months to complete. So a couple takeaways from the case study. First is to allow sufficient time to develop and test the user interface. As part of testing, it's really critical to have CMS's eligibility team come in and review and provide feedback on the partner's UI prior to conducting the business audit. This will help partners identify problems that can be addressed early on and allow the partner's audit and CMS's post-audit review to go much smoother. You want to provide as much time as possible to prepare for the security audit. The documentation requirements there are substantial. And then you'll want to submit early in the audit window to allow sufficient time for CMS to conduct and complete its review in advance of open enrollment. The farther you drift back in the audit submission window, the more risk you have of not being approved in time for the start of open enrollment. So some lessons learned from this. One is that don't try to do this in 2 to 3 months unless you want to shut down your company's business and just work on this. It's best to start as early as possible, allowing at least, I would say, 6 to 8 months prior to audit submission. Second is you want to start simple, either with phase 1 or phase 2. Phase 3, I would only suggest going for phase 3 if your business absolutely requires it. Phase 3 is quite complex and is by far the longest implementation. You'll want to avoid building EDE's eligibility application on an existing individual and family plan application or platform if possible. Generally, partners who try this have often had to reboot their project just because there's such different types of builds. Testing plays a significant role because of EDE's unique nature. You don't really know what you have until you start testing it. And as I noted earlier, have a CMS eligibility team come in and review your UI prior to the business audit. That will pay dividends for the post-audit reviews. Next, security. There's really one thing, a couple things that CMS fears most about EDE. One of them is a serious data breach. And so can't emphasize enough the importance of working on security. You'll have to convince CMS that you have and can maintain a robust security posture on an ongoing basis. Like I mentioned earlier, CMS reviews takes months. Allow sufficient time for CMS to conduct its review of your audit materials. Get a FedRAMP certified auditor, preferably one that has experience working with CMS's audit submission and approval process. That's really important, making sure your auditor has that experience because there's a lot to learn and not much time to learn it. And then finally, Be aware of CMS's continuous monitoring standards and the need to manage EDE's compliance on an ongoing basis, and plan for supporting that over the long term. So with that, I'm going to turn the virtual mic over to Jermaine to talk about preparations for the security audit. Jermaine?
Thank you, Pete. I appreciate it. My name is Jermaine Jones. I am the co-founder and COO at Ostendio. My past, I've been a builder of infrastructures, and through that, cybersecurity and integrated risk management. I'm here to talk to you specifically about the security readiness. And as Pete stated in so many slides back, the security, right? So one of the biggest things and the longest tent in the pole might be you as an organization building out your security program. Now, number one, let's focus on the understanding what the security components are for CMS EDE success. So being that CMS is a government entity, it basically subscribes to the NIST 853 framework, and it's used to determine the maturity of your organization's program. Now, what CMS did essentially was they actually created a subset of security and privacy controls for organizations to meet their criteria. Now, there are about 292 controls that need to be implemented within the organization. Now, that's a little bit more than just having policies and procedures. It's more in depth of not only having the policy, procedures, and the documentation, but also having the actual controls implemented in your organization. That means any type of tools, endpoint protection, things of that nature that are actually operationalized in your organization. Now, CMS actually thinks that all the controls that they've suggested are critical controls. However, they've taken a moment to actually point out high-risk controls to the organization that, if not fully implemented, can prohibit you from actually gaining authorization. As part of the process, there are several artifacts that need to exist inside the organization, not only from your policy and procedure and your organizational documentation. However, there are CMS-sponsored documents that the organization needs to work through in order to deliver their security package. So understanding what CMS is requiring. So CMS considers, again, as I stated, 292 controls in the EDE system, as well as your system security and privacy plan. Now, the CMS has provided a list of these high risk controls. Again, if they're not fully implemented, so I'll show you a bit later in the slides what those high risk controls look like, but if they're not fully implemented, that could be the success or failure of the organization going through plan in and of itself. So CMS expects that the organization will try to implement 100% of the 92 controls. However, entities that do not submit reach the basically are able to submit 100% of the controls. There is the ability to put together a plan of action and milestones that you're working towards mitigating those controls. Now, that being said, as I stated before, anything that's marked as high risk does not have the capability. They need to be remediated prior to submission to CMS. Now, that does not necessarily mean that you can go in with 100, moderate risk findings and think that you're going to automatically, still be pushed through the process. CMS will foresee issues with when you're running a number of those moderate controls with a long list of remediations as a possible high risk. So too many moderate risk can equal a high risk. So, if you're going through this particular process, make sure that you try to meet 100% of the 292 controls. At the end of the day, CMS is looking at an overall security posture of the organization and its ability to maintain it. So it's not, as Pete stated before, it's not a one and done. These are scenarios that you have to maintain over a period of time in order to make sure that your organization is adhering to the security and privacy program CMS is requiring. As you can see on this particular slide, I did a call out because I wanted to show what the high risk controls are. And some of them, an organization might meet right off the bat. There are other ones that they may not even considered. So for example, one of the controls that every organization should be adhering to is security and awareness training. And if you're not actively doing that, CMS will take it to the extent of there's actually roles-based training that may need to be adhered to. So if you have a developer, that the developer is actually making sure that they're getting their specific type of security training when it comes to developing the solution. Another area of high-risk control is the independent penetration testing. Now, as part of the CMS package and going through the process, it is a requirement that you do have an independent penetration testing. So, at least that's part of the process in and of itself. But I won't go through each of these individually, but it's something that you should be aware of as an organization that will help level set where you need to focus, what you definitely need to remediate right off the bat and make time and energy to put effort into. Now, again, there's two processes when it comes to the security. There is the implementation of the privacy and security controls. So your organization has policy and procedure documentation. They have tools that they put in place like endpoint protection, IDS or intrusion detection systems, firewalls that they actually have, that are effective for the environment. Not only that, but diagrams of, the network, what the actual system architecture is and scopes. And so all of this is built in as part of your security program, but it goes even further than that. So not only do you have to have this program up and operationalized, you have to be able to present CMS with evidence that you're doing what you say what you're saying that you do inside of your policies and procedures. And they have to be in alignment with the 292 controls that CMS is asking that an organization meet. So for example, on the evidence collections and maintenance side, so routine security tasks, account monitoring, backup recovery, screenshots, all this information that you have to, right now, you may have to pull from disparate systems. And this is why Pete said it's best to have an integrated risk management tool or compliance tool to be able to host all of this data into one specific tool so that you can, essentially point to that tool and pull the information out. So that's the security program. The second part of it is the actual components that CMS requires that an organization actually submits to them as part of their package. So as you can see here on the screen here, you see a list of documentation. So CMS provides templates for your plan of actions, for your privacy impact assessment, which an organization has to go through to determine where all of their privacy materials lie, who has access to that particular information. All of these documents basically becomes a package. They get bundled together along with your policy, procedure, and evidence. And this is what gets delivered to your assessor. And this is what your assessor will be carrying out its assessment against, is basically all of this information. So not only is CMS will eventually see this, but your assessor is takes the first pass at it before actually passing it on CMS. And this is something that Stephen King will be able to walk you through as we move along. As you can see on the last screen, there is a link there. Basically, it's a third-party auditors directly from cms.gov. You can read through. It's a great package as well. So this next slide, again, as Pete pointed out, basically is an outline of a potential customer that's actually going through the CMS EDE process. And as you can see, it runs from September to September before they actually before the actual approval and go live date. This is just a representation. The first half of the screen is actually, because there are what you'll see at the top is the UI path, which is the business path, basically that the development that the organization is going through in order to deliver the application. The second path is the security path. And as you can see here, the difference when you get to the auditing, the preparation standpoint, so the first line there is the assessor security start date. As you can see that process is a bit longer than it would be if you're actually just going through the business audit. Now, again, you know, I don't want to steal Steve's thunder, but he'll take you through this as it were. But what I wanted to point out here was that these things are done in tandem or in parallel. So the entire package gets delivered all at the same time to CMS. So when you're going through this process, make sure that you have a dedicated team for security and you have your dedicated team for development. How we, and again, part of my role here at Astendio is to deliver our professional services arm, which helps companies that are going through the CMS EDE process to actually work their way and develop a workflow path and how to achieve the next steps in getting through this. Because there's so many moving parts in security alone, this is just a high-level overview. One of the things that we make sure that we do is we conduct interviews, understanding where you are as an organization, understanding what your system does, what its boundaries are, is a first step in having us basically put a scope around all these things that need to be done in accordance with those 292 controls. We walk through a gap identification, planning and implementation, and evidence collection, as well as remediation. So this is how we, you know, work through the process in order to get all the evidence, the artifacts that are needed in order to pass down to the assessor as we walk through this process. So the big question is, how do we get there? There's a lot of pieces, there's a lot of moving parts. I don't know, you know, how big my team is, you know, this thing seems to be, you know, too much for us. So the one thing that you need to do is that, you know, obtaining and maintaining authorization for EDE is no small task, and it requires dedication and hard work. You know, understand the level of work. I've been in many organizations where they'll, you know, make the CTO the security, the CISO, or they'll make someone else in the organization. This particular path will require someone to be designated and dedicated to maintaining and building out the security and privacy program. So number one, make sure that you know, you build a team around the person that's responsible for maintaining or at least obtaining the security portion of the CMS EDE. Determine your workforce, right? Is it just internal people? Do you need some experts externally to walk you through the process? If you're looking for external support, make sure that at the very least that they have gone through the CMS EDE before, have some appreciation for it, or that have gone through a FISMA or even a FedRAMP audit certification. Those people understand the level of effort that it takes to get authorization from CMS. Understanding the maturity of your existing security program and understanding where your gaps are, determining your scope, system boundaries, and work with a dedicated assessor early in the process. You know, if you can queue them up, the earlier you can queue them up, the better you'll be, as they can at least give you an understanding of how the entire process works. Invest in a compliance tool, right? An IRM tool like MyBCM to help document and manage the security program. It can be extremely difficult to manage this using spreadsheets and folder drives to maintain your security program. And then, not from least, I'm not going to go through each of the bullets, but develop a workflow for working through the process. You have to do it's a step-by-step process, and you have to make sure that you cross your T's and dot your I's. So those are my thoughts. And at this point, I'm going to hand it over to Stephen King to talk to you specifically about the going through the assessment portion of it. On to you, Stephen. Thank you.
Thank you, Jermaine. I am Stephen King from Align. I am our strategic account executive and also the federal subject matter expert here. I have been involved in cybersecurity auditing and assessment now for almost 25 years, and I've operated within just about every framework that's out there, to include the CMS audits. So I'm going to talk a little bit about the audit process and what you can expect as an entity that is seeking authorization. It all starts with the CMS Operational Readiness Review. The Operational Readiness Review, or ORR, is an audit and assessment process that reveals the overall level of risk in processing sensitive data within an EDE entity's organization and the solution. The ORR examines three key areas of the entity's solution, which are the ability to meet the business requirements needed to determine an applicant's eligibility, the security and privacy controls implemented to protect the applicant's personal identity and health information submitted, and penetration testing that reveals certain technical capabilities and potential deficiencies in architectural design. All three areas must be successfully completed in order for an entity to achieve EDE partner status. In the next few slides, I'll examine each of these areas in more detail. Next slide, please. The business requirements audit focuses on the performance and capability of the entity's enrollment application. The independent auditor utilizes CMS-developed toolkits to examine the application user interface, the solution's communication capability, the application program interface, the sharing of eligibility results, and Spanish language implementation. And auditors such as Align will examine the application's user interface to determine whether all eligibility screening questions have been implemented in the correct manner and are being displayed to the user accurately. Within the communications toolkit, we verify that eligibility results are accurately and promptly communicated to the applicant for follow-on enrollment steps. The API functional integration test validates that the solution is accurately processing the applicant's information that's submitted, and that the logic used in eligibility determinations is sound. The eligibility results generated by the entity's solution will be examined against defined test cases created by CMS to ensure that the eligibility results returned are correct. And finally, the ability of the solution to provide applicant instructions in Spanish will be examined to ensure that the information conveyed is being conveyed in a manner that is that of a native speaker. So anything within the application that is translated in Spanish will be examined. And next, please. The next component is the security and privacy audit, and this is the controls, security controls that Jermaine mentioned. As an auditor, we are going to examine the entity's implementation of security controls as defined within NIST Special Publication 800-53 using CMS's expected level of rigor. The security and privacy controls, and there are 292 of them, are expected to be implemented at a level that ensures that the data that is being processed is protected against unauthorized access or unauthorized change or any malicious activity that could harm the applicant or the entity or CMS. We will take a look at these control implementations to determine if there are deficiencies in control deployment. Any deficiencies that we identify are going to be included in our security assessment report and reported to the EDE entity so that they can attempt to remediate those controls. Remediation is accomplished by maturing a particular security control and minimizing the risk that is introduced to the data that's processed. We'll also be looking at vulnerability and compliance scans that are conducted against the operational environment to ensure that configuration settings deployed within applications and computer hardware are meeting basic security benchmarks established by CMS. Again, anything that is identified as being a vulnerability or a deficiency is going to be included in our security assessment report for future remediation. The next slide, please. Lastly, the penetration test. The pen test is a component of the security and privacy assessment, but it is conducted as a separate task, and that's why I list it here separately. Pen testing, as you can imagine, is an examination of the technical environment. We're going to be looking at the configurations, again, much like with vulnerability and compliance scanning, but this time using an experienced team of penetration testers who will manually be using their own tool sets to execute exploitation events. The pen testers will be looking at the environment and checking to make sure that the confidentiality and integrity of the data hosted in the application is protected. They'll be looking at the effectiveness of the technical design and at the effectiveness of the organization's training program to ensure, again, that that PII and PHI, personally identifiable information and personal health information, is protected. The penetration testing that occurs at the organizational level involves social engineering tests and phishing exercises to ensure that personnel understand how to protect data, the things that they need to do to ensure that that data is protected. Next slide, please. So the three components, the business audit, the security and privacy audit, and pen testing, are all performed in parallel. At the end of testing, we are going to combine the results of all three of these tasks into the security assessment report. There are actually two components. We have the business audit report and the security assessment report that are submitted to CMS. Both, however, do talk to and speak to the level of risk that we as the auditor have identified. Okay, so the CMS folks are going to take a look at those reports, and they're going to make a risk-based decision, and they're going to basically decide whether or not the EDE entity's solution should be authorized as an EDE partner to be able to process data. As I mentioned, the results of the pen test will be incorporated into the security assessment report as well. Any deficiencies that we identify as a result of pen testing will be documented there as well, with recommendations on how those deficiencies can be matured, how they can be resolved. One thing I want to note here for methodology is that access by the auditor to the EDE entity solution to the production environment is required throughout the audit. Not only our pen testers, but our security and privacy auditors are going to need access to the production environment in order to run through the risk management framework test cases and the toolkits provided by CMS. We will document within the rules of engagement how these test events will be established, how the credentials will be shared between EDE entity and Align stakeholders. We'll also talk about the scheduling of the testing and any other rules that need to be put in place, such as alerting of entity stakeholder personnel so that they understand that some activity they may see within the production environment is related to testing and thus not causing undue alarm. So next I'll talk a little bit about the audit project flow. The audit project will start with a scoping or kickoff meeting. This is the initial meeting where we will invite all stakeholders to discuss how the audit process will unfold. We invite CMS to this meeting so that they can ask any questions and so that they can maintain awareness of the audit as it proceeds. There are two things that we will be doing at this time also during the kickoff. The first is we will be sharing with the EDE entity an information request list. This is an initial artifacts gathering request to help us to prepare for the coming onsite. At this time, we will ask for the system security plan that defines the entity's solution and will allow us to gain an understanding of the architecture and the processing that occurs within the environment. At Align, we will use the system security plan to develop a security assessment plan. The security assessment plan, as I mentioned previously, will contain not only information regarding the solution, but also the rules of engagement that Align will be following to ensure that we are completing all aspects of the audit in a meaningful way. The security assessment plan must be shared with the CMS personnel prior to onsite occurring so that we can receive their authorization to perform as defined within the rules of engagement. After this, after the security assessment plan has been finalized, we will issue a phase 2 information request list, which is a more detailed, mapped list of artifacts that we will be gathering during the assessment. Jermaine mentioned 292 security controls in his segment of the briefing. And that's what this IRO will be mapped to. We're going to be looking for artifacts for all 292 controls so that we can build those validation statements in our security assessment report that shows the level of risk in the system environment. Next, we'll actually schedule and perform the on-site assessment. the business audit, and the penetration testing. Again, all three of these will be conducted in parallel. So we will be bringing multiple personnel, multiple teams that will be working with the entity's stakeholders to ensure that the project proceeds on schedule and as quickly as possible. One of our goals here is that at the end of these three tasks in parallel, we're able to bring the results of the three components together into that security assessment report and be able to present that to CMS in a timely fashion. During the development of the security assessment report, there will be an opportunity for the EDE entity to remediate anything that we discover as findings. Anything that we determine to be deficient that is not meeting CMS's expected level of rigor will be reported to the entity as soon as it is identified, and the entity will have an opportunity to mature those particular controls or to change a particular feature within the in the solution, so that again we can validate and move on to the next phase. Finally, the closeout briefing will be held with all stakeholders, again to include CMS, so that we can discuss the results of the overall audit and assessment work, discuss the contents of the security assessment report, answer any questions that CMS may have, sometimes conduct additional testing, but ultimately close out the audit portion so that CMS can make their risk-based determination and ultimately issue an authority to operate. The audit schedule, this is a breakdown of rough timelines of how long it takes to perform each segment. Okay, so first the business audit, that typically takes about 4 weeks from project kickoff. The security and privacy assessment is 6 weeks, and the penetration testing 3 weeks. We do try to synchronize these as much as possible so that at the end we are arriving together with the results of each of these pillars. If there are delays in the process, we do ask that the entities coordinate with us as the auditor, and we can work within our schedule to meet or to stay as much on track as possible. But the key takeaway, and this was mentioned previously, we need dedicated commitment from an entity's resources to ensure that we stay on project schedule and can get you to CMS's approval point as planned. Because of the narrow nature of the window to be open for applicants to be able to utilize your solution, we want to make sure that you're utilizing the audit time as best as possible so that you're meeting those CMS established deadlines for opening the market. Once the three audit segments are completed, we're going to develop that business audit report and security assessment report, and that takes about 2 weeks from the time that the three components are completed. Then we're going to submit that security assessment report and along with the system security plan, what we call the overall security package, to CMS, and they will conduct their review and we will work with the EDE entity until that package has been approved or the entity withdraws from consideration. Okay, with that, I'll turn it back over to Ian.
Awesome. Thank you so much, Steve. Lots of great information here. I want to, right before we get into a couple questions, just sort of share the takeaways that I had from this to kind of put a bow on all of the great information from Jermaine, from Pete, from Steve. 4 sort of things bubble up to me the most. One is in the EDE process, you want to start early and budget yourself more than enough time than you think you might already need. We saw a lot of information about the complexity, the scope, and the time. And with all the different eyeballs on this and all the different ways that this is reviewed and details that are checked, you need to make sure you have plenty of time. Get your leadership team bought in on this, get them bought in from the beginning, and make sure that your leadership team stays committed and continues their support throughout the process. It's one thing if they sign off on it, but if they don't actually support you and help drive this process, you can run into problems down the road. Outside expertise is really important. Very few people have gone through the entire EDE process yet, so it's important to make sure that you're working with the right partners. Work with an experienced auditor, someone who knows the ins and outs of this, someone who's done this. So when you talk to an auditor, think about what you heard from A-Line, from Stephen King, someone who's done all of this before and knows how to help guide you as a partner through this process. And then look for a seasoned advisor, someone from an external perspective who's been through this process, who has helped other companies without necessarily having to wear the audit hat. Someone like a Pete Nakahata, who actually has been successful at getting people through this approval process. And then lastly, you know, and we wouldn't be here if we didn't believe in this strongly, use an integrated risk management platform. Use something like Ostendio's MyVCM. You want a system of record. You want to help, first of all, make sure that you're documenting everything that you're doing the first time you do this, and then you want that system of record to make sure that you can get through future audits easily and with less upfront work next time around. So make sure that you're looking for the right outside human expertise, and make sure that you're looking at the right technology to help you go through this process. So we've just got time for a couple of questions here, and I am going to read from a couple of the ones that have been put into the chat here. And I'm not sure who wants to answer this one, but let me start with this one, which is kind of a little bit of a scary one, which is what happens if you go through this process and then you aren't approved by CMS? So Stephen or Pete, I'm not sure who wants to jump on this one, but I'll open the floor.
I can take this one. So if you are not approved, say next year you file and are not approved after you submit your audit, what will happen is you'll basically just continue on to the next audit review period. And we've seen this happen in the past. There have been partners who have started 1 year, not been able to complete the approval process in the available time, and have just basically, CMS has basically let them continue on and continue working towards approval so that they can be approved to the following year. Steve, I don't know if you have more you want to add to that.
Sure. Yeah, I can share that we have worked with a client who, due to some architectural changes that were required by CMS, actually had to delay for a year. So it is important that you engage with CMS and they have an understanding of your architecture as you begin the process to, again, help get through as easy as possible. You don't want to get caught with any gotchas at the end, right? Because we have seen that before. But as Pete mentioned, if you have to delay, the good news is you can kind of pick up where you left off. As long as nothing has changed within the environment, we're going to be able to continue to get through the audit process in the next cycle and get you to that authorization.
Awesome, thanks. Another question, can you change your phases as you're going through the process? So for example, if we decide that phase 3 we bit off more than we can chew, can we switch down to just doing a phase 2 certification?
So I can take this one as well. And the short answer is yes, you can, but you need to understand that the phases, particularly the builds between phases 1 and 2 versus phase 3 are very different. Phases 1 and 2 are similar and arguably build on phase 2, can build off phase 1. Phase 3 is a very different build because it contemplates a different sort of different type of collection of the tax household information than phases 1 or 2. So if you start with phase 3 and you want to downshift from phase 1 or to phase 1 or phase 2, you need to be prepared to sort of significantly alter your build in order to be able to do that. It's possible, but it takes a lot of work. So it is better, and that's why I was saying in my presentation, it's better to start simple with phases 1 or 2 and then go for phase 3 later.
Yeah, that makes a lot of sense. Okay, excellent. We are going to pause now just because we are at time. There's a few more questions that I'm going to make sure we do some personalized one-to-one follow-up on. In the meantime, I've made sure that the email addresses of all the presenters are up on the screen here. So Pete, Jermaine, and Stephen, all of them have their email addresses. Please reach out to any of them or us with more questions that you have. In the meantime, thank you very much for joining today. We will send out an email with follow-up for you to be able to access the slides and share the recorded version of this webinar with your teams. Thank you very much and have a great afternoon.